Good morning, everyone. We have our fantastic patient here who had breast implants 2008.
2000 breast implants and a lift, post-baby.
And she's a fantastic social media marketing person, trainer, and she's here to have her implants replaced. And I want her to kind of introduce herself, give us some background, and tell us why you are here to have your implants replaced.
Great. Hi, I'm Emily. So after I nursed for 16 months a baby who would never take a bottle, just put that in your head, I was ready to revamp my breasts. I guess you call it a mommy makeover. Nipples were displaced. It just was a situation, and I could not wait to do that. And it was quite life-changing. I had a breast lift and very small implants. But now here we are, what is it, 17 years later? I can't do the math. Things have changed, things have shifted. I lost a lot of breast tissue just from being in perimenopause, menopause. I'm a trainer, getting fitter. I definitely have lost some weight, but also I believe the estrogen loss changes your breast tissue. And I am ready to swap these out. There is some capsular contracture, and they look very different than originally. I don't feel good. I feel uncomfortable in my own body. And frankly, that's when the call arises to see a doctor and see a plastic surgeon. So of course I came to Dr. Sayah, knowing that he's the best with breasts, with natural revision, primaries. And so after doing my research, here I am in the chair.
Fantastic. And who referred you to my practice? You don't have to mention names, but just another patient.
Yeah. So, I was referred through a patient. I actually sent someone, having not even seen you myself, but understanding her process. And I was like, I've got the doctor for you for this. Her case was kind of complicated, a rupture, and she just, it's life-changing.
She had a very difficult surgery.
She had a really difficult surgery.
And she had multiple other implants in the past.
Yeah. And she had leak. It was just bad. So
great.
Yeah.
Well, welcome to the practice again.
I'm so excited.
So on examination, which we'll show you later on your next video, her implants are really far apart on her breasts. She's lost a lot of natural breast tissue, and so she has huge cleavage. So I can put my hand between her breast implants or her breast. And so we wanted to have a more natural, flowy breast as opposed to kind of a very round, separated breasts, which I think doesn't look natural. It's not very becoming for you.
It's not becoming.
Right.
It feels awkward. I like to feel confident, and that's the moment when your confidence is down, nothing good happens.
So Emily also came in requesting the new Motiva implants. So I want to show you all what the difference is. So this is the new Motiva implants. They came out with a new shell. And they actually have very limited size options for us, and also very limited breast implant shape options for us. Because implants come in different shapes and sizes, and now even different thicknesses, or I should say different cohesiveness of the gel. So if the gel inside is really cohesive, it's a firmer gummy bear feel. If it's a lighter gel, it's more flowy. It's still gummy bear-ish, but it's just more flowy. So this is the exact same implant from Allergan, and you can tell one is much wider than the other. Motiva has very limited kind of sizes and shape options, but they do have this new shell which they brag about and market about. And so when we're trying to achieve better cleavage, which means implants that are sitting together on the chest, a wider implant is probably best, particularly if we want to go with a natural look. And if somebody has a very very narrow chest and they want to go with a larger implant, we can't fit a large implant on their chest. So we go with a higher profile implant like this. But regardless, these are both your options. And it's also important to note, everyone says, well, I want a teardrop implant, which they don't make anymore, by the way. If I just take this and I go like that, you can tell nearly most implants assume a teardrop shape when you're standing, and when you lay down, if anything, they tend to your side, and they, again, look more natural. A higher cohesiveness implant doesn't have that flow. When you hold it up, it's less of a teardrop, and when you lie down, it's still kind of centered on your chest. It doesn't flow as much. So that is kind of like a compromise that patients have to make for themselves, when they want to go with a firmer implant that has no flow versus one that is kind of more gelatinous and has more natural flow.
And I gotta say, it was really interesting to come in and get this education from you, because I had no idea. I just heard about Implant, Motiva, people are talking about it, you're seeing on social media, and you really don't know. And for example, given my chest and the width and the, you know, I'm kind of broad across.
Yeah.
I ended up thinking that one actually makes more sense, because I'm like a 37, like I have quite a large back, and I don't want to have like a ball on my boob, on my chest.
So in this practice, I'll give you, like all the other patients, all the information you need to make an informed decision. It's your decision. We'll be happy to get either implant for you, like with all the other patients. And so go home, think about it, and come back. Okay. And this, again, I mentioned this online before. What do we do mostly in this practice is revision surgery. The easy implant, kind of simple breast augmentation, so super easy. So something like yours, more complex, still perfectly easy and doable. We get plenty of them. So I'm happy to do it for you.
Me too, I'm thrilled.
Grateful that you're trusting me to do the procedure for you, and we'll follow up with you all later.
Yeah.
Thank you.
Thank you.